Good morning. I would like to thank the organizing committee, in particular Professor Pimentel Santos and Professor Jaime Branco. Also thank you to all the attendees of this talk. And my name is António Palmeira, and I'm the head of the research center called CIDEFS, and this is the logo, you can see it here. CIDEFS is based in the Universidade Lusófona, and I'm also the executive director of an international society called ISNPA, and that's the International Society of Behavioral Nutrition and Physical Activity. That's a mouthful, as we usually say, but it's really very focused on what I'm going to talk. So my talk is going to be about the different roles of exercise during COVID-19. But knowing that we are all tired of hearing information about COVID-19, I will focus mostly on the behavioral aspects of physical activity and how they cascade to other healthy behaviors. I will try to show you how exercise is a catalyst to healthy behavior patterns, including diet, sleep, sedentary behavior, and of course physical activity itself, and also to health-related outcomes that cascade from our physiology to our psychosocial life. So this talk will be organized in one first component that I called survival, then recovery, and then some closing and opening remarks, as you're going to see. And I'm hopeful that this survival phase of COVID-19 is behind us. And note that by survival, I'm mostly meaning this phase at the population level, when we all tried to avoid infections and be more prepared to deal with it in the case of infection. Maybe a better name will be preventive phase. So during this survival phase, exercise played an important role, mostly helping prevent greater severity of COVID-19 at the population level. It was a sort of immunization vaccine, whilst there wasn't one. So let's start looking into the role of exercise during this survival period. And it did play an important role. This was even recognized during the lockdowns, as exercise was one of the few activities that allowed us to go outside our homes. I would say that exercise played different roles that can be categorized in physical health, movement, and mental health. At the physical health level, I will briefly mention the role of exercise in overall health and immunity. And this is a graph that we show to all undergraduate students in physical activity and health sciences. This curve represents the relative risk of mortality of all causes in the vertical axis, in relation to different levels of physical activity in the horizontal axis. We can see that in the left side, more to this place, in the left side, the relative risk of mortality is higher when the minutes per week of physical activity are very small or even none. Then it decreases substantially, even with small number of minutes per week. This is where we see the largest drop in mortality. Then it reaches a sweet feasibility point at about 150 minutes per week. This is the current WHO recommendation, about 150 minutes per week. But also notice that the WHO acknowledged the health benefits of less than 150 minutes per week. And this was released in the latest recommendations from November 2020. And the tagline of those recommendations was, "Every move counts." And this idea that every move counts boosts the motivation of the individual that does not do anything. One may think, hey, I can do a 5-minute walk and I will still be moving towards a better health. After starting with these 5 minutes, then it can increase to 10 minutes and so on. And so it will be more feasible to increase that number closer to the 150-minute goal. Another physical health benefit is the known immunity booster shot provided by regular physical activity. This is clearly evident in the works developed by Niemann et al., especially at the upper respiratory tract infection rates and they noticed that those rates were lower in regular exercises even when exposed to the same infectious environments. And also, so this means that we can state that exercise may have represented the first vaccine or forced vaccine, under quotes, against COVID. And also, they show that infected individuals were more fitter, have experienced on average a less severe disease. So this was physical health. Now let's briefly look at movement. And movement is another definition. So we have physical activity and we have sedentary behavior and so on. But now they are all combined in this idea of movement. And movement can be described as a state of change in a system. So our system changes their states. And recently, several countries adopt what is called the 24-hour movement guidelines. Because during the 24 hours of the day, we are either sleeping, on the top here, in sedentary behavior, in the bottom here, like sitting, commuting, in light physical activity, walking, standing up, or in moderate to vigorous physical activity, bicycling to work, exercising, sports. And they are all interconnected. If I increase sedentary behavior, some of the other movements will need to give. They will be reduced. So this is a systems approach to movement. And as such, as this systems approach to movement, researchers have suggested that we can target one of these behavioral movements and have repercussions on others. In this paper, the authors targeted sedentary behavior to counterbalance the confinement rules that kept us home. In their model, this will allow for less issues at the cardiometabolic level and thus less problems in the case of infection. And see how they target one, knowing that it will affect the other movements that we do. And one of the other movements, again, this is not movement, but it's the absence of movement, is sleep. And sleep is known to improve via regular physical activity. Thus, it was expected that more regular exercises will present better sleep during COVID, or if they had COVID. But in this study, no associations were found. So what they did was they evaluated several individuals that had COVID, and one of the things that they evaluated was sleep. So they have divided the ones with good quality of sleep and poor quality of sleep, and looked at differences on their physical activity, and no associations were found. But this is the only study I found, so the evidence level here is quite small, and as almost all studies in COVID now state, more research is needed, and that's what we're going to see maybe in the future. Finally, let's focus on mental health, and if on sleep we have very scarce evidence, this is the area where the evidence seems to be more clear. Regular physical activity was an important behavior to counteract the effects of lockdowns at the mental health level. The evidence is so clear that we also already have some twin studies, so controlling for genetics. And in this one, the authors showed that when one of the monozygotic twins maintained their physical activity level, the anxiety level was lower when compared to his or her twin that decreased the physical activity. And you can see here the results. So we have now ended this preventive survival phase. Let's dive into the recovery phase. Here, the unknowns are much bigger. We are just entering this phase, if you consider as a population level again, and there are a few exercise health mechanisms that are believed to be true after the infection, but the evidence is scarce. So taking this into consideration, I will present a few solutions. Firstly, let's look at the mechanisms that link movement, exercise, physical activity to better health. And we usually focus on this mechanism that sits in the top. So movement through physiology gets better health. And this is indeed of great importance. So cardio-respiratory fitness, metabolic changes, and so on are the putative mechanisms of this path, leading to better health. But I will also ask you to pay attention to the lower mechanism path, so involving the psychosocial mechanisms, where positive emotions increase, better relationships, and increased cognition capacities are a direct result of movement, leading to better health. Having these two paths in mind, so the physiological and the psychosocial path, we can start looking at potential solutions. So let's start with the vital sign. We know that movement increases the cardio-respiratory fitness level, and CRF, cardio-respiratory fitness, has been suggested to be a vital sign by the American Heart Association. They state that it should be assessed alongside blood pressure and other cardiovascular health-related diagnostics. So one should take care of this vital sign. But look what happened to me. This graph is my VO2 max, a measure of CRF, from May 2020 till May 2021. Note that in November 2020, there is a sharp decrease. And this was the time that I was confined because my wife tested positive and had COVID-19. Neither me or my sons tested positive ever or experienced any strong symptoms. But this dip in VO2 max reflects something. So either the test was a false negative, or the effect of being under the stress of having someone in my family with the infection and limited behavioral options. For example, I didn't go out for my afternoon run during this period, led to this dip. And it took me a while, you can see almost only in February or something, and I did need to train myself quite systematically to recover to previous levels. So it was quite difficult to do this, and I think I'm I know what I should do to increase my fitness level. For sarcopenia, it was evidence from the start that by asking people to limit their quantity of movement, we will have muscle mass and strength loss. And this is clear in the evidence. This is just one paper. I've been wondering that we could figure it out a nice number, and that number is how many kilograms of muscle was lost during the pandemic, which should be a good idea about the impact of COVID on at the population level. And as you can see here, I want better, and what do I want better? Better sleep. Sleep hygiene seems to be more and more important after the disruptions caused by the lockdowns. And in this paper by Altin et al., they point out practical recommendations aiming at better sleep during or after COVID. And these authors mention that regular physical activity is key to better sleep hygiene. And this is in odds with the paper I showed you before. But again, that was just one paper. This is another. The jury is still out, as we usually say. And finally, and maybe the most consistent result, showed that well-being was decreased during the pandemic. This is a meta-analysis with more than 100,000 people. We think that the exercise feel-good factor is a potential component to be used to counteract this decrease. This exercise feel-good factor is the feeling that is it's evident after one do some exercise. So I go for a walk, and just after that I feel better. I go for a run and my positive emotions grow. I feel more competent. I feel my self-esteem increases. So this feel-good factor could be one of the factors to be used during this period. And that is also why physical activity was one of the excuses, of course excuses under quotes again, for getting out during the confinement. We are now, as a community, the physical activity sciences community, we are looking into how can we extend this excuse after the lockdowns. So some mechanisms and some solutions for the recovery. We are moving, always moving, of course, but here towards the closing of this talk. And I would like to see this closing, but also this part as a closing, but also as an opening, a start of something that each one of you will do to consider movement in your own practice. So we will have a few knowns, more than a few unknowns, and then a simple set of recommendations. So what do we know? We know that the effect of movement is only present while you keep doing it. So the regression to the mean is clear in exercise interventions, I would say in most interventions, of course. If you stop, the benefits usually disappear. This was also called the Nike effect, usually when we look into weight loss interventions, where I do a lot of my studies. When you start losing weight, when you start an intervention to lose weight, you do lose some weight, but then the weight regain creeps in. And so that's why we have this logo very similar to Nike. The other things that we know is that physical activity at the population level in Portugal is quite low. So 2 in every 3 Portuguese do not exercise. So we have a lot of work to do, but also we know that the benefits are very clear from the start. So the impact at the population level will be very interesting. And we also know finally that starting a behavior and sustaining a behavior are different beasts, are different processes. So we need to look into sustainable solutions, not only at something that works at the acute level. The elephant in the room here is, what movement should I recommend for someone who had COVID and has lower CRF and sarcopenia and so on? This is the biggest unknown. And for that we can look into previous SARS, because if you keep forgetting it, but there was one SARS before SARS-CoV-2 to have some ideas about what to do. And it seems that an exercise intervention was very effective and safe with SARS, the first one, survivors. You can see here that the exercise group that was randomized to the exercise intervention improved in several measures of cardio-respiratory fitness, strength, and so on when compared to a standard care group. And so we can use this information and look into what exercise was prescribed in those studies and develop something for COVID-19. The evidence for SARS-1 is limited, so this prescription that I'm going to show you should be tested in SARS-2. And this is why we, and when I say we, Professor Pimentel-Santos was one of the proponents, submitted a proposal to the National Foundation for Science last year. It was called MISHES, Movement and Exercise After COVID, which was designed to test this prescription in COVID-19 survivors. So we had 16 weeks of moderate intensity, 40 to 50 minute sessions, 120 to 160 minutes per week, and include strength training aiming at sarcopenia. It was not funded, but we know at least that something similar to like this should work, and we should be aiming at the long term, at the sustainable solution. We need to think of exercise as a chronic treatment, a behavioral long-term solution. So you see, when I stopped doing exercise, my CRF dropped almost immediately. So some knowns, some unknowns. What can we do? What I'm going to show is what I've been working for almost 20 years in this society, that behavioral nutrition and physical activity society. And the current evidence points at something that we can do. So from the physical activity science, almost the studies almost come up with the same conclusion. we need to add a physical activity person in the medical teams. And from the behavioral change maintenance science, they say, again, add a behavior change person to your teams. It seems that I'm trying to find a job for my friends. That's not the case, of course. But what we know is that either physical activity or behavior change maintenance science have such a large body of knowledge at this point that a specialist is needed to improve the probability of people doing the correct physical activity and sustain that physical activity for a long time. For example, a behavior change person is knowledgeable about motivation, and I will almost bet that each one of you have felt or have experienced the lack of motivation, as we usually call, that is present in your patients, and they don't take the medicine or they don't do the exercise sustainably. And so behavior change maintenance specialist will know what kind of variables are associated with the better outcomes. For example, they will know that it's needed to have what it's called the wantivation instead of the mustivation. So the way that people integrate what they need to do or what is prescribed will be very important to increase the likelihood of sustained behavior, or on the other side, decrease that likelihood. And in the case of exercise, or in the case of physical activity, the treatment only works when it is sustained for a long time. So this was my talk. I hope you have enjoyed it, and I'm here waiting for your questions.